Hi, I'm Sandy Johnson, and I am a AAA fellow, and we are here to discuss secondhand smoke, its dangers, and raise awareness in the community. We have Miss Judy Brown, who has been our coach, as well as Mohamed Mohamud from Pillsbury United Neighborhood Services, as well as the Confederation of Somali Communities, and Miss Lisa Dunlap from Pillsbury United Community Services. Welcome. We're going to be talking about secondhand smoke and trying to raise awareness in the community about its dangers, and also using the innovative ways that we have been able to target the communities of African as well as African American. So we have individually completed a fellowship under LAMP, and LAMP stands for, my comrades will help out,
Leaders and Advocacy Institute for Advancement for Minnesota's Priority Population.
What a mouthful. And LAMP is a multicultural project that was 2 years, correct?
Mm-hmm. About 18 months.
About 18 months. And it has been funded by Clearway of Minnesota and developed by Appeal, which is Asian Pacific Partners for Empowerment and Leadership. And this is a multicultural project that we've been a part of to use to build leadership, capacity, and coalition building in our communities to address secondhand smoke and to make people more aware of the dangers in our communities. And we will begin to talk about how we have done that in our communities. Judy, could you tell us how we have been successful in reaching our target population?
Well, it really depends on how you would want to define success. In relation to our work as LAMP, well, your work as LAMP fellows and my work as LAMP coach, we were part of a 18-month experiment, you could say.
Experiment, okay.
Because, this was the first time they've done this in the community in collaboration with Clearway, Minnesota. And we were charged with learning various, I would say, technical assistance techniques, whether it be in the area of media and advocacy, grant writing, public speaking. Can you guys think of some of the other?
Coalition building, definitely.
Yes.
Cross-cultural coalition building.
That was a big one. And community readiness, that's the big issue that we have to...
and most importantly,
communities,
as well as fundraising from alternative sources.
Yes.
And
lobbying,
accessing the public policy community process. And the fellows are composed of representatives from the African American, GLBT, Asian American Pacific Islander, as well as the Latino Chicano communities. And most of us, and
the Native
American communities. And most of the fellows have full-time positions, and some are in school, but we were able to go through this training process because we were dedicated to our communities and making sure that people were aware of the dangers of secondhand smoke, and also to complement the Freedom to Breathe Act, which luckily, and with a lot of hard work that has been in the years making, past October 1st. So we are trying to make sure that we stay on the cutting edge of keeping the awareness of the dangers of secondhand smoke so our children can have a healthy environment.
Right.
And the reason, some of the ways that we've been doing that is we have been doing small in-home presentations, and they differ from community to communities. Mohammed, could you talk to us about the Somali?
Well, Somalis, we are really a group of people who are working with me as a AAA African American group that already graduated from the LAM, which is already mentioned. And our community, Somali community, really they are a problem of a misunderstanding how the dangers of the tobacco have.
Okay.
So really it's facing that, explaining exactly how they prevent the secondhand smoke is really a challenge. So we tried our best to have conversations, presentations, and giving some pictures which is showing that the dangers of the secondhand smoke have. And already they really are going on a just understanding, but it is the starting.
Mm-hmm.
Yeah,
Okay.
it's just kind of beginning now, and but I think if the community addresses that kind of secondhand smoke, since the ordinance of starts October, and they are just following the rules and the laws that comes out from the government and agencies which is controlling the tobacco and its problems.
So one of the further things to say about the Somali community is that it's hard to address the women in regards to secondhand smoke because they're not going to admit to you that they smoke. You know,
Okay.
so it's not an open discussion.
Is that a cultural? Would you say it's a cultural
Yeah.
issue regarding smoking and women?
Really, you're right. Somali woman is really
Very private.
It's very private to smoke. Really, I didn't see when I was back home in Somalia that a woman is smoking. But it's not. We cannot say that women exactly they are not smoke. They smoke, but they may hide themselves. Because if she comes out smoking, she looks that she's loose woman. So she don't want to be out of the community. So she have to hide if she smokes. But
And then to address it, you know, is even hard because they don't even want to be seen talking to
Exactly.
someone that's addressing the secondhand smoke or even the smoking issue because they don't want to, you know, be labeled.
Right.
You know, so.
And therefore, it would put the children at greater risk for secondhand smoke because they would probably be more exposed to the smoking because it would be done indoors.
Right. Really, we exactly addresses to mention that the children should be out of the smoking areas. But if the mom smokes and exactly in her home, it's real difficult to avoid from the children. So it's risk, but we will make a campaign of saying free home tobacco or free home secondhand or smoking, all of that. So we'll try our best to address that risks.
Okay. And both of you, Lisa as well as Muhammad, do cessation programs. Could you talk about, have you seen an increase of people calling for more help regarding tobacco-free or nicotine?
Well, since the law was passed, I find more people getting ready to be, they're wanting to prepare themselves more than before because
Okay.
They're not going to be able to go out to restaurants, and they are understanding that they're going to have to do something about their situation because they can't just sit at home and smoke. So as far as an increase, I've had an increased inquiries of what to do and how to get started, but not so much as the quitting part, but that is the first step. The
Okay.
first step is when they start asking and inquiring, and the more they come to you, it may take several times before a person say, okay, I'm really ready to commit to quitting. So the increased inquiry is good. Is a good thing.
It is,
It's
indeed
a very
it
good
is.
thing. So, yeah, I would say that there was a slight increase.
Yeah, really, we do a cessation program by individuals and group sessions. Although women are mostly we use individual or one-on-one method.
Okay.
Well, really, yeah, the people are really worried about that. They have seen a picture of if, for example, now is prohibited in restaurants and all lobbies on everywhere, which public and affairs. So the people are thinking that if this step comes, then the second step will be further that. So they are just saying, okay. And after a while, it may became a situation that nobody can smoking or in where the people are living.
Okay.
So it's good starting really, and the people are worried about that, right?
I would like to add that normally in the 3 years that I've been doing smoking cessation, I would do one-on-one.
Okay.
But since the law has been passed, I've started a group. And I've started this group because they live in a no-smoking facility. So you match the no-smoking facility and you can't go out and smoke. So then that did create a greater need for people to quit. So I think the increase of group may start. So hopefully.
Okay. And could we talk about how the tobacco industry targets our community? Each community, whether it's GLBT, African American, Somali, Chicano, Latino, Native American, there are different campaigns used to target us, definitely, but there are different types of tobacco cigarettes just used for certain communities. So could we talk about some of the ad campaigns?
Well, I think we probably should take it a step further back. When we think about the project that we're doing here as LAMP Fellows, one of the most unique aspects of the project is the fact that we have the opportunity to tailor secondhand smoke presentations to specific communities. So where we may be reaching out to a Somali or Oromo community, we're not using the mainstream method to do so. In African American community, we may not just be going to community groups. We may be going into churches. If we're talking about the Liberian community, we may be going into a community center. So we have all these various venues, and within each venue, we have highlighted as well as identified various aspects of how the tobacco industry targets our specific communities. So a part of a presentation is to incorporate pictures in magazines, various forms of media in which we know the media has targeted our communities. So a part of our presentation is also raising the awareness as to how the tobacco industry may target Oromo population, may target the Somali population. You think about blunts and what are the flavored cigarettes now? They're just cigarillos. Now they're coming out with flavors.
Okay.
And when you think about mass media, you have to think about the videos and how some of the rappers are advertising the use of these products. You think about the old Asian ads in the Jet magazines where they have Virginia Slim would have that Find Your Voice campaign. So there's various forms of media in which the tobacco industry has used to target our communities specifically. Just as we are using to inform our communities, they've done the very same thing in using some of the same tactics. They know us better than we know ourselves in a sense, and they go after us in that medium. So I think, just to say that we're just as creative as the industry when it comes to us being able to inform our community has a lot to say about who we are and how invested we are in making a change in the health risks associated to smoking within our communities. There's a large disparity, and people of color seem to be the ones suffering the most.
Definitely. And our budgets are smaller.
Yes.
So we have to be more talented and more diligent in reaching our community. And there are definitely incidents where we may have to go back and do repeat presentations in order to definitely make sure that people realize the lingering effects of secondhand smoke regarding children and particularly infants. Regarding young women who are pregnant, there is definitely an increased risk of the child, when the mom smokes during pregnancy, that the
this child
low
might
birth
have
weight.
colic, underdeveloped lungs, increased SIDS, the sudden infant death. There's a lot of in vitro or in utero spontaneous abortions, things like that. You know, so so there's a lot of effect of women smoking, and they don't feel, you know, they feel like, oh, it's something I've always done, but you know, you're carrying another life in you that doesn't have the lungs that are, you know, complete like yours. You know, you have new developing lungs that can't even develop because they're being hindered by smoke. So, you know, it is a problem.
And this is all pre-labor, and then there are plenty of studies that have shown once the child is born, they are more susceptible to lower respiratory infections such as bronchitis, asthma, as well as middle ear infections. Definitely a large amount of emergency room visits have been attributed to undiagnosed lower respiratory infections for young people.
The exposure has contributed to 150 to 300,000 visits to the hospital a year for upper respiratory problems and bronchitis and things like that. And so,
asthma.
You know, you're not born with asthma. You know, it's something that happens after, you know, because you have been exposed to something that's hindering your environment. Yes.
Yeah. Okay. All right. And what are some of the tactics, like when we've done our presentations, and we all have done presentations differently. Lisa and I have done presentations at the church as well as
the
community center, Oak Park. And we've had a couple of presentations done at homes, private residences. Okay.
Yeah, residents. We do 1515 Park Avenue. That's a very huge building for that most of the Somalis are living somehow. And we do also in the Brian Cole Center. It's also many Somalis are coming through the community. And this exactly addressing how the people are, just even when you are invited the people and came, some smokers and non-smokers, they just came and they just put their ideas and talking about what they think. Mostly the elder people, they are really worried about the rising of the youth, Somali youth,
using
the tobacco now.
Okay.
And this is really a huge issue, which is really now arising now. And although our cessation program is 18 and up as an adult, but really it's worry about how we address that, because it's arising now. Many people, many young people are starting smoking. As the United States, you've seen that more than 6,000 persons starting every day in the United States. So they are the part of them, and really they are even rising, even more, I think, because they are just thinking, a new country, and they are thinking that if someone smoking, and they have seen, it's just imitating them.
Okay.
So that's really difficult also.
And studies have definitely shown that youth begins, or people that begin smoking, they begin smoking under the age of 15, and they find it harder to quit. And mainly the reasons are attributed to peer pressure, to wanting to fit in, not quite stressed yet, but definitely peer pressure and wanting to fit in. And with our project with LAMP, we have been, youth are not our focus, but we are definitely looking at trying to get additional resources to target our youth, because like Muhammad said, that we do have youth that are starting younger, and it is definitely more challenging to stop smoking the younger you start.
Well, the studies say that if they start before they're 18, they're more likely not to quit. But if they start after they're 18, that they have a higher chance to quit smoking. So, and usually people, long-term smokers, they really want to quit. You know, they all say, I really want to quit. You know, it's just, you know, it's an addiction, and they do realize it and they understand it. But the problem is that it's not something easy to do. It's a hard situation to be in. And doing the secondhand smoke presentations, it's easier because you're reaching out to people that don't smoke, and they're being affected by people that do smoke. And so they're very interested, and they do ask a lot of questions. What should they do when now that the law has been passed? You know, when they walk into grocery stores and people are standing right at the door smoking, you know, how should they handle that? I get a lot of questions about, you know, I live in an apartment building and people on either side of me and up and down that they all smoke. How do I handle that? You know, and then I tell them, you know, you have to do things like when we do the Smoke-Free Homes Pledge, fill out those pledge cards. You know, when we turn that information in, and the more that we turn that in and ask for funding to combat secondhand smoke, the better chances that you'll have in the future that there will be some smoke-free buildings. More, there are some now, but there'll be more smoke-free buildings, and that people are more aware that just because you don't smoke, that you are being affected by people around you that are smoking. You know, smoke knows no boundaries, you know. So.
And when we do our presentations, what are some of the challenges that we have faced when we do our secondhand smoke presentations? Judy, what were some challenges that you faced?
I don't know. I can't really answer that question because I never started off with doing the presentations. I know I just can speak secondhand from what you have identified as some of the challenges, and I don't know. I don't know if you want me to speak secondhand. I can give you the opportunity to speak really for yourselves because...
Okay. Well, go ahead.
Really, there's a challenge, which is, as a Somali community, they may come late. For example, when you are finishing, so you have seen some people are coming now, and there's difficulty. The other thing, the outreach is also a challenge. It needs to call the people, to make the flyers out, and really it's not easy. The other thing, it's not really easy. So, and the other challenge, which is really I think that the important one is misunderstand that the people doesn't know exactly the risk of the smoking. So they don't care. They have money priority for them. So it's really one of their, it's not the first or second or third priority. So they just came as just wasting time or something like that, some people, because they didn't smoke and they didn't think that secondhand smoking is affecting them. So they may just say, okay, I will come. They may come, they may not come exactly, but that's one of the difficulties that we have with.
Okay. Well, I know. Okay, go ahead.
Well, for me, the challenge is getting people in the funding. You know, it's hard to sit in a secondhand smoke presentation when you have your children. You know, a lot of people are they're not, like he said, they're not prioritizing it as, you know, number one. People grew up in homes where parents were smoking, and it was okay to smoke in the car, and it was okay to, you know, so they feel like, look at me now, I'm fine, I made it, you know, so it's not as big of a problem. But the studies that, you know, just recently come out is, you know, it's saying that it really is a problem, but there's so many other things that they have going on that they say right now I really can't focus on secondhand smoke because I don't smoke, and I can't focus on what they're doing over there. And even though it could be a problem, it's just not their number one priority. So I think that people do want to know the information, but they don't want to really ingest that this could kill me. I could die, and it's something that I'm not doing, you know. So it's hard to focus on that.
So in addition to recruiting and retaining people, even just getting people to be interested in secondhand smoke, especially as a non-smoker, has definitely been challenging. We have had to convince people to allow us to present to their already established groups. Sometimes even though we offer a small incentive, it's still very challenging. But we have been successful because we are diligent and we are truly committed to making our community much more safer and combating the use of commercial tobacco in our community. The onslaught of advertising in our community alone is an entirely different show that we do not have time for. So,
well, one thing that you mentioned is that how do big tobacco, target our neighborhoods? And it's just like when you go to the corner store, you can hardly get through the door without seeing 5 different tobacco signs covering up the whole door. You go in and there's tobacco signs at your waist level. Who is down there? Are you going to bend down to read the tobacco signs? You see the commercials, you see the billboards. If you're a smoker, you already know what's in the cigarette, so it's not anyone that's getting this bird's eye view but the children. And if they constantly have this, then it becomes the norm. What's so different? I see my mom smoking, my dad smoking, everybody in the neighborhood smoking. What's different? It's okay to smoke because obviously they want me to. They put all the advertisement right there. So that's some of the ways, they do other things like, promote concerts and different things. So, and like you said, they back the rappers and the rappers are talking about it and it's in the videos and different things like that. And that's what the kids are, that's what they're seeing. So, of course.
So thank you so much, our distinguished panel members, Ms. Judy Brown, Mr. Mohamed Mohamud, and Lisa Dunlap. Thank you for tuning in, and we are available for presentations. We can be reached at AYES@yahoo.com, or we can be contacted at 612-377-7000 for secondhand smoke presentations at your church, community center, synagogue, or mosque, or wherever you feel comfortable. And please ask for Lisa Dunlap, again, AAAs@hotmail.com.
You said 2 different things.
Yahoo.com. And 612-377-7000. Thank you so much. That's it.